This is Janet, a 19-year-old college freshman. She's excited about her independence, focused on her studies, and exploring the world of dating. But along with the excitement comes confusion. She knows she doesn't want to get pregnant, but when it comes to contraception, she's overwhelmed by the options and myths. Pills, patches, implants, condoms. It feels like an exam with too many multiple-choice answers. Janet decides to get clarity by visiting her doctor. In the doctor's office, Janet voices the questions many young women have but rarely ask out loud. Which contraception works best? What about side effects? Can I get pregnant later if I want to? Her doctor smiles. These are important questions. Today, Janet is about to learn the science behind contraception, from temporary to permanent options. Contraception means deliberately preventing pregnancy by interfering with ovulation, fertilization, or implantation. It doesn't just mean not having kids now. It gives people control over when and if they want children. From a medical standpoint, this is one of the most important tools in reproductive health. Globally, nearly half of all pregnancies are unplanned. Contraception reduces maternal deaths, unsafe abortions, and financial strain. For Janet, contraception isn't just a pill or device. It's a ticket to freedom, the chance to graduate before diapers, and to plan her future on her terms. Hormonal contraception uses synthetic versions of the body's natural hormones, estrogen and progesterone. These work by stopping ovulation, so no egg is released, thickening cervical mucus, so sperm can't swim through, thinning the uterine lining, so even if fertilization happened, implantation is unlikely. It's like setting up 3 layers of defense against pregnancy. The pill is one of the most popular methods. It's taken daily, ideally at the same time each day. Combined pills have estrogen and progestin, while mini pills contain progestin only. Both prevent ovulation and alter the reproductive environment to prevent pregnancy. The key is consistency. A missed pill reduces effectiveness. The pill is 91 to 99% effective depending on consistency. Pros: it regulates periods, reduces cramps, improves acne, and lowers the risk of ovarian and endometrial cancer. Cons: nausea, mood swings, and remembering daily doses. For students like Janet, forgetfulness is the biggest hurdle. The patch sticks to the skin and delivers hormones through the bloodstream. Replaced weekly, it's easier for those who don't want to remember a daily pill. The downside: skin irritation, and it may be less effective in women over 90 kilograms. The vaginal ring sits inside for 3 weeks, releasing hormones locally. It's removed for 1 week to allow a period, then replaced. It's discreet and convenient, but some women dislike the idea of insertion. Depo-Provera, the injection, provides contraception for 3 months. It's highly effective, but can cause irregular bleeding and, with long-term use, reduce bone mineral density. Doctors usually recommend calcium, vitamin D, and monitoring bone health. A small rod under the skin of the arm releases progestin for up to 3 years. It's one of the most effective methods, over 99% effective. Drawback: irregular bleeding and the need for a minor procedure to insert and remove. The hormonal IUD sits in the uterus and releases progestin for 3 to 7 years. It prevents sperm movement and implantation. Many women love it because periods become lighter or even stop. Downsides: insertion discomfort and irregular bleeding at first. The copper IUD contains no hormones. Copper ions are toxic to sperm, preventing fertilization. It lasts up to 10 years and can also be used as emergency contraception. But it may make periods heavier, which can be a deal breaker for some women. Common side effects include nausea, weight changes, breast tenderness, mood swings, or irregular bleeding. Most fade after a few months as the body adjusts. For Janet, knowing what's normal and what's not is key to avoiding unnecessary panic. Estrogen-containing methods slightly increase the risk of blood clots, strokes, or heart attacks, especially in smokers or women over 35. That's why doctors carefully screen medical history before prescribing. One myth is that contraception causes infertility. In reality, fertility usually returns within weeks to months of stopping. Another myth: birth control causes cancer. In fact, Pills reduce ovarian and endometrial cancer risk. Female sterilization, or tubal ligation, closes the fallopian tubes. It's 99% effective and permanent. No eggs can meet sperm. It's usually for women who are certain they don't want children. Male sterilization, vasectomy, involves sealing the vas deferens. It's safe, quick, and over 99% effective. But again, it's intended to be permanent. For Janet, daily pills might be tough to remember. A patch, implant, or IUD may be better for her lifestyle. The best method balances effectiveness, convenience, side effects, and her future goals. Doctors and patients work together. Factors include health history, sexual activity, period regularity, and desire for future children. The best contraception is the one a woman feels comfortable using consistently. After learning her options, Janet chooses a long-acting reversible contraceptive, effective, easy to manage, and giving her peace of mind during college. Reminder: hormonal contraception prevents pregnancy, not sexually transmitted infections. Condoms remain essential for STI protection. Safest strategy? Dual protection. Use a hormonal method for pregnancy prevention and condoms for STI protection. It's belt and suspenders for sexual health. If accidents happen, emergency contraception can help. Pills like Plan B work best within 72 hours, while a copper IUD is effective up to 5 days. It's not abortion, it's prevention. Contraception is about empowerment. It gives women the freedom to pursue education, careers, and relationships on their terms. Let's recap. Pills, patches, rings, injections, implants, IUDs, condoms, and permanent solutions. Each has pros and cons. The best method is the one that works for you. With her choice made, Janet feels empowered. No constant stress, no confusion. Just focus on school, her dreams, and the freedom to plan her life. Contraception is more than pills and devices. It's a public health tool, a personal choice, and a pathway to equality. If this episode of Medical Minute gave you clarity, don't forget to like, subscribe, and hit the bell. Together we can make health knowledge simple, clear, and empowering. For Janet and for millions of women, the best contraception is knowledge itself. Because the most powerful prescription is knowledge.